Welcome to this week's Wellness Wiki. Today's topic, sick care versus health care. As many of you know, on the first Monday of 2022, I had the opportunity to speak on national news about the X's and O's of the immune system. During that interview, I talked a bit about the trouble with our current healthcare system and that it is reactive, not proactive. In fact, nearly 100% of the attention during this pandemic has been defensive measures to protect against getting the virus, where there's been little to no attention towards naturally building immune function, an offensive measure, should you or your child contract the virus. In this Wellness Wiki, I will compare and contrast 3 different ways of thinking about health. When done listening, please take a moment and spend some time on the reflection opportunities. Next week's Wellness Wiki will dive much more deeply into the different paradigms of healthcare. This one is setting the stage for much deeper concepts. I'd like to start with the parable of 3 runners. Joe, John, and Jane are triplets, all members of the high school's varsity cross-country team. They decided to participate in their first marathon together during their summer break. Joe read a couple of books about how to train for this marathon, but he didn't prepare his body for the punishment he would endure. A couple of weeks before the race, he noticed a dull ache at the bottom of his foot. Just to make sure he was okay, he went to the doctor to get it checked out. Turns out, Joe had a stress fracture in his foot. By checking it out early, Joe prevented further damage that could have happened had he run the race. This would be an example of prevention, or really, early detection. Joe's brother John was a little more proactive than Joe. John started training months before Joe. He stretched and did other exercises to strengthen his body. By maintaining his body the way he did, he ensured himself an opportunity to not only compete, but possibly even finish the race without injury. And then there's Jane, Joe and John's sister. In addition to stretching properly and exercising, Jane also made sure she fueled her body efficiently and maintained ideal form, spinal alignment, ensuring optimal nerve flow throughout her body, and made sure that her muscles, organs, and glands were functioning optimally before the race. She did regular meditation, prayer, visualization, and goal setting. Jane's preparation gave her the best chance to finish the race without injury and the best chance to win the race. In our current healthcare system, most of what is referred to as prevention is really early detection. No doubt, certain tests are important to have done routinely to discover disease processes before they get out of control. However, once an issue is identified, even if it's early, it's already a problem in many cases. Early detection is a very important aspect of caring for an individual, but if there's already a problem, is it really prevention, aside from preventing it from getting worse? And we know there are medical interventions that fall under the category of prevention with the goal of avoiding contracting an infectious disease and or controlling an existing illness. These prophylactic measures may include vaccinations, cholesterol medications, bypass heart surgery, and antibiotics. However, most of these are not without some form of risk, and they most certainly will not make a person healthier. At best, they prevent the disease they want to avoid, but these interventions are not salutogenic. The term comes from the Latin root salus, which means health, and the Greek word genesis, which means origin or creation. Salutogenesis ultimately focuses on the factors that lead to the creation of health. This is contrary to pathogenesis, the creation of disease. A lot of people talk about their goal to maintain health, like John in the example you just heard about. The individual who desires this is ultimately seeking the same or similar goal as prevention. Essentially, they want to remain free from health challenges. As noble as that endeavor may be, they're just maintaining the status quo. Then there's an entirely different thought process that, again, we talk about as health promotion or salutogenesis. This is about taking purposeful steps within a wellness lifestyle to encourage optimal health as the result. This entails conscious choices and actions throughout a lifetime to not only avoid bad things from happening, but by making your body and mind as strong and fit as possible to encourage great things to happen. A wellness lifestyle is for the people who want to win the race of life. Here are some reflection opportunities. Think about what you currently do in your life for disease prevention for yourself and your children. What do you currently do for injury prevention for yourself and children? What do you currently do to promote health and wellness in your household? 2/3 of my book, Dream Wellness, The 5 Keys to Raising Kids for a Lifetime of Physical and Mental Health, is dedicated towards giving you ideas to live a proactive wellness lifestyle. Here are 5 examples of things that we do in our home on a regular basis to promote health. If you even do just one of these suggestions, you'll likely be better tomorrow than you were yesterday. Each of these are categorized in the most appropriate facet of health. Diet. Switch one of your unhealthy snacks to mini cucumbers or carrots. Feel free to dip them in hummus. Hopefully it's a natural organic hummus. Relaxation. Take 10 deep breaths at least once a day. Inhale for 10 seconds and exhale for 10 seconds. Exercise. Stretch your body for at least 10 minutes daily if possible. Being an adjustment. Check and modify your head and posture, your body position when you're using your phone, your tablet, your computer, including right now as you're listening to this. And then mental wellness. Think about something or someone you're grateful for. If it's a person, consider sending him or her a note. Text or email will suffice to show your appreciation. When you have 20 minutes, take the dream score if you haven't already and see where you are in your wellness walk. Based on your answers, the report will give you suggestions that are proactive measures you could take starting today. It's free and it only takes about 20 minutes. Just go to dreamwellness.com/dreamscore and take it today. Thanks so much for listening to the Wellness Wiki today, and I hope you'll subscribe at wellnesswikis.com and get our Wednesday Wellness Wikis every week. Until then, we look forward to helping you and your family live your dream every day.